Scientifically speaking, we're sharing the view. From labs to clinics, breakthrough shining through, with minds that inspire and stories to unfold. Scientifically speaking, the future's being told.
Welcome to Scientifically Speaking with Christine on Oz Arab Media, where we bring the latest insights in health, science, and innovation. Today, we're diving into a crucial topic for women's health: hormones, menopause, and skincare. For many women, navigating menopause and perimenopause can feel very overwhelming, with symptoms ranging from hot flashes and mood swings to changes in skin health. But with the right information and care, women can thrive during this phase of life. To help us break down the myths and facts surrounding menopause, perimenopause, women's health, and skincare, we're joined by one of Australia's leading voices in women's health, Dr Ginni Mansberg. You may know her as the Sunrise GP from her regular appearances on TV, where she brings expert medical advice to audiences across Australia. Dr. Ginni is not only a highly experienced GP, but also the medical journalist, podcaster, and healthcare consultant. She serves as a supervisor at the University of Notre Dame Sydney Medical School and is the author of 5 books, including the popular The M Word, How to Thrive in Menopause. In addition, she is the founder of her own cosmeceutical skincare line, blending her medical expertise with her passion for skin health. Dr. Ginni, a very warm welcome to Oz Arab Media.
Thank you, Christine. Thank you for thinking of me. I really appreciate it.
Of course, we thank you for the time and effort to be on our channel as well. And if you don't mind me digging straight into our topic, and my first question would be, can you tell us a little bit about what inspired you to focus on women's health, hormones, and skincare, being a GP, author, and a media doctor?
That is such a complicated question. I think I fell into everything. Nothing happened by design. I'm not that organized and I'm not that strategic.
Awesome.
I can't say that I was like 5 and I had a dream to be, to be all of these things. I think in terms of the women's health section, you kind of reflect the audience, your patient group. Like I can tell you, Christine, when my kids were little, I felt like all I did was young mums and lots of child health. And then, a lot of those kids that I was looking after are having children themselves. And my kids are older. I'm going to be a grandmother. Like it's just a different phase of life. And as you go through into your 50s, your focus changes because it's always all about us, right?
That's true.
And I feel like particularly menopause is really underserved. It's just an area that I don't think doctors do that brilliantly with. And I have to say that before I was obsessed with menopause, I was really obsessed with polycystic ovarian syndrome, which is something that I have that is super common in the Arab community here in Australia. Sure. It's just been a lifelong passion for me. I think some of us have got not the best genes, and then you shove into that not the best lifestyle and a few other things with your immune system going rogue. Right. And so I've always had that real passion for hormones. In terms of the skin, because I've had that polycystic ovary syndrome my whole life, and I think a lot of our listeners can relate to this, my skin has been a total disaster. I want to throw F-bombs everywhere, but it's just been terrible. So I've always had cystic acne, and I still had my acne and went straight into rosacea at the same time, which is just kind of across the face, but super, super sensitive. Now, if you can imagine being a TV doctor, so you come on with this horrific acne and the makeup artist look at you and go, right, let's get the trowel out covering your face.
From the other end then.
Yeah, and then you've got to get it off, right? And
that's true.
It's painful. So there were just so many things happening. I really wanted to get evidence-based. Like I would do segments on TV about what really works in anti-aging skincare, thinking I really need this for me. Couldn't find it on the shelves because I think a lot of people cut corners. If this works, maybe I'll do a little bit of that. They're close enough, near enough is good enough. And I was like, no, you know me, Christine, I'm so OCD about absolutely everything. And I had to get it 100% right, which meant that I had to make it myself. And here we are.
Amazing. So it all comes really from a personal experience, if I may say. You're also known as the Sunrise GP and have been helping people with medical advice on TV and in books. What do you enjoy most about making health information accessible to the public?
So you can run into a few conflicts here, but I'll tell you what my passion is. And I have felt for a long time that the days where my parents went to the doctor and the doctor was this professor up on a pedestal, whatever they said was pretty much the word of God. They sprinkled down fairy dust of their genius, and my parents were the grateful recipients of whatever they said. And then those doctors would gatekeep. Yes, you can do this, you can't do that, you're going to do this, you're going to do that. And that has always felt wrong to me. I'm a Gen Xer. I grew up in an era where I went to university. I'm not an idiot. You don't need to treat me like an idiot. But not only that, if you have a look at the future of healthcare in this country, we have a chronic shortage of doctors and nurses and qualified healthcare professionals that is getting worse. Year on year, the shortage of GPs is getting worse.
Fortunately.
And we have people like us, like you and I, and like so many people who are listening to us today who want a seat at the table in their own healthcare. And how convenient. That works out really well, because I don't want to be gatekeeping everything. That doesn't work because I don't have enough appointments in a day.
That's true.
Plus, it's not about me. It's about you. My role is to give you information so you can make informed choices about your body and your health. That is such a passion for me, that the delivering of information to people so they can make an informed choice for themselves. And whatever that is okay. It's your body. It's not about me. It's about you. Whatever you want is okay. But I need you taking a seat at the table, because our government, our world can't afford for it to be all about me anymore. So I think that's really the passion as well.
That is amazing. I hear you. It's very hard to find a doctor nowadays, and a very good one as well. If we can dig into menopause, it is something every woman is experiencing and will be experiencing. Yet many feel very unprepared about it. Why do you think menopause is still a taboo topic, especially in Australia? Like, it's surprising.
So I think that there are, broadly speaking, two things at play. I think there's still a little bit of misogyny in our community, but also ageism. And I think that menopause is where ageism meets misogyny and has a baby, and it is in sitting there in menopause. And women don't want to age, and so we're fighting against that. And it's like, la, 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 I can't hear you.
In denial, yeah.
I mean, it wasn't, do you remember the TV show, The Golden Girls? They were in their 50s. They were all grey-haired and old and negotiating their irrelevance to society. Right. I don't know any women in their 50s who are happy to accept that now. We want to go on hiking holidays. We want to be at the coolest restaurant. We still want to be making a great martini recipe. Like, we are not accepting our age. So I think there is all of that.
Right.
On top of that, will you allow me just to indulge me in a little bit of a history lesson, because this is really important.
Of course.
Back in the 1990s, the top-selling drug in the United States was one called Premarin, which is a form of estrogen, a synthetic tablet of estrogen for HRT made out of the urine of mares. We don't really use that anymore, but like literally the pregnant mares, they would take their wee and turn it into a drug. Yeah, so it was used to treat menopause. And back then, there were very large, what we call cohort studies. So they just observed people, ask them all of these different questions and see if they could pick up any patterns with their health. And that's how we found out that high blood pressure is really important, in a really important cause of both strokes and heart attacks. We found this out through cohort studies. And what they found was that women who were on HRT back in the 1990s had fewer heart attacks than the women who weren't on HRT of the same age. And what they realised is that there is something about being on estrogen that protects the heart. And so they went, you know what? We need a massive study, but let's not give women in their 50s the HRT. We already know it works for them. Let's recruit a clean group of women with an average age of 63, well past the period where we still need HRT for the symptoms.
Right.
And 1 in 4 were over the age of 70. And they said, let's give half of them a placebo and half of them estrogen, and let's just see what happens if we can prevent heart disease, because it's the number one killer of women. Let's see what happens. So after 6 years, they noticed two really important things. The first thing is, no, it did not decrease the risk of heart disease. In fact, it slightly increased it.
Wow.
And as a result of that, we now know from this study that we did not know before, that if you have estrogen continuously in your body, it continues to keep your blood vessels soft and protect you from a range of cardiovascular diseases. But if we withdraw estrogen because you go into menopause and your ovaries cannot make estrogen anymore, and then we reintroduce it into the body, it flips from being something that protects your heart to being something that accelerates heart disease. Good to know. Now, if you've been 10 years past menopause and you want HRT, you really need to think about that risk, that cardiovascular risk.
True.
One of the things that they noticed off to the side was, apart from the fact that there was a 35% reduction in bowel cancer and a 35% reduction in osteoporosis fracture, that for every 10,000 women who took the placebo, they got 30 went on to get breast cancer. But for every 10,000 women who took the HRT, 38 got breast cancer. So there were an additional 8 breast cancers per 10,000 women per year of the study.
Wow.
And as a result, they did not think, you ladies are all smart enough to work this out. This was an older group of women that had no estrogen in their bodies for a long time. We'd reintroduced it. Yeah, if you take the group of women who are in their 50s, there was no increased risk of breast cancer at all. It was just this older woman. But they went to the media and said HRT causes breast cancer, and boom, the garage door rolled down on women's health and menopause. What we saw was 80% of women choose to throw their HRT in the bin when they read the headline.
And
doctors refused to prescribe it. And to this day, I then got no training in menopause whatsoever. Not one day, not 1 minute, not one day. Gynecologists get no training. Endocrinologists, hormone specialists get no training. And women were told, this is so you're a bit hot. Don't worry about it. You'll be fine. You'll get it up.
Yeah.
Princess, you're just being a bit hysterical.
Oh.
And so if you look at studies that go back to doctors, doctors continued to take it for themselves. They knew that media is wrong. But because of the risk of lawsuits and the fact that you couldn't get any, because half the drug company that made Premarin went into receivership. So because of all of that, the legacy has continued where people think that HRT is dangerous and that anyone who just can't put up with a few hot flushes is a pussy and they should just suck it up. And that's what we're dealing with today. This is what women are dealing with today.
Unfortunately, it's sad to hear all of this, but a lot of women do feel things, and it's not just, hallucinations or just keep it in denial. So if you can tell us a little bit about some symptoms that women experience during perimenopause and menopause, are there any that might surprise people?
I think there are lots that will surprise people. And I think the last count, there were like 51 or 52 symptoms.
Wow.
So everybody thinks about hot flushes, and it is the most well-researched symptom of the menopause. And it does impact 75 to 80% of women. 1 in 3 of the women affected by hot flushes describe them as unbearable. So 1 in 5 women will have unbearable hot flushes. The rest of us often don't recognize that we're having hot flushes. So a lot of women expect to have a Hollywood-style hot flush, go beetroot red, start sweating like crazy, have to jump in a swimming pool or an ice bath. That is not what happens. Most women just go from being the cold one and their husband has to warm them up all the time to being the hot one in bed. And he's just going, whoa, get off me. You're too hot. You're boiling me up. She's now the one who says, I can't sleep with a doona. I don't want to sleep with pajamas. That is what's happening. She doesn't recognize that as a hot flush, but that is exactly what a hot flush is. And it's not always unbearable, but it's unpleasant and it interferes with sleep. So we know that menopause is the peak time for insomnia. My patients fall into bed exhausted, often at 8:30 at night. They cannot get to sleep fast enough, and then come in at 11 o'clock at night, being they're awake, and they are awake continuously the whole night. Yeah. One thing that we don't talk about enough is the high risk of depression and anxiety. If you'll allow me just to explain this a little bit.
Of course.
1 in 10 women get postnatal depression, and we should and we do pay a lot of attention to that. But 1 in 3 women will get anxiety and or depression at the time of their perimenopause. That is the highest risk time in a woman's life, and it's the highest risk time for suicide for Australian women between the ages of 45 and 55. No one talks about that. And it has particular hues. It is less sad and more anxious, more panic attack, more social anxiety. A lot of women just don't want to go out anymore. They just don't want to leave the house. They feel much more safe at home. Their girlfriends ring them. They get a text. They don't even ring them back. There's also a lot of dysregulation of their mood with a lot of rage. So we have people losing it at their sister-in-law. I have so many people in my surgery going, I just blew up Mother's Day. I just blew up Christmas, that kind of thing. At work, they have conflict with people. Their best friend of 50 years is now an enemy. Their sister-in-law. These things are happening a lot. So they have these particular hues, and it's slight paranoia, taking things the wrong way. Someone doesn't return your call and all of a sudden you're going, well, you never return my calls. You're always, you don't care about me the way I care. Taking things the wrong way. So that's one. I also did want to talk about joint pain. So we know that for women from Asian backgrounds, which will be, maybe some of the people who are listening to us, the same numbers that get affected by hot flushes amongst Europeans, they actually get affected by joint pains that are very responsive to estrogen. Now, for what we don't have a lot of studies on is studies in Arab cohorts. So what we don't know are Arab women closer to the Asian women and getting more of the joint pains or more of the running hot.
Oh, wow. So you have the joint periods.
Yeah. So
you have the joint pains.
So I do think, in my experience, it does impact Arab women with a lot of joint pains, a lot of back pain, a lot of knee pain. Hand pain is really common, around here.
Wow.
Those kinds of things are very, very common, but I don't have statistics for the Arab community specifically, but those are things. A lot of people don't expect their hair to fall out, their skin to become itchy and sensitive, but also, sorry guys who are listening, it does really impact down there.
Yeah.
So the bladder and the vagina are both hugely impacted, and that can have huge impacts in relationships, and it can be very difficult for women to deal with. And we know that unlike your hot flushes, where, look, 1 in 5 women will continue to at least occasionally get a hot flush in their 60s and 70s, not generally that bad. Right. But 1 in 20 women is a super flusher, flushes forever severely.
Wow.
But for the vast majority of women, if you wait it out, it peaks 2 years past menopause proper, and then it starts to go away. The vaginal symptoms get worse and worse and worse year on year. And if we don't treat it, the ceiling, how good I can ever get it when I do treat it, comes down. So there is a bit of an imperative to talk about it. And yet some studies that were done in the UK showed that less than 7% of women who know that they have a problem in their vagina talk about it with their GP. And I love talking about vaginas, and I love looking at vaginas. I do that all day, and yet my patients don't even talk to me about it. It's not often until I do a pap smear and go, whoa, okay, things are looking a little dry down there. Do you want to talk about it? And then they go, yeah, actually, it is a bit dry. And now that we're not doing pap smears anymore, even those opportunities are going to be few and far between. So, I would urge women to talk about it.
Yeah, I agree with you. And we did talk a little bit about why women are worried about, hormonal therapy. Just like you mentioned, maybe it came from a study. But in simple terms, if we can explain what it is, the hormonal therapy, and who it is suitable for.
So what we're doing with your hormonal therapy is, in the case of perimenopause, when your estrogen is up and down like a yo-yo, is just to reset and flatline it. Your body does not like the up and down estrogen levels. So that's what we're trying to do by taking the job away from the ovaries and the pituitary gland that is buried deep in your brain, and give that to a body identical form of estrogen that is given to you generally as a patch or a gel. Sometimes some people can have it as a tablet. We prefer to give it as a patch or a gel, and we take that job away from your ovaries. Having said all of which, we're not trying to replicate the levels of estrogen that you had when you were 35. We're trying to make them just enough to get rid of your symptoms. So it's a much lower dose than the contraceptive pill, and for that reason it's not necessarily going to be a good contraceptive. So you do need to have another contraceptive on board. Who can have it? This has changed a lot in the last few years.
Yes.
So we used to say there are criteria of this woman can't have it, this woman can't have it, this woman can't have it. And these days the conversation is very much what we call a patient-centred care, with the patient at the centre of the decision, where our job as doctors is to bring the risks and the benefits to them and to let them decide. So I now have patients with a history of breast cancer who previously would not have had access to HRT, who choose, even though they know the risks, to go on HRT. I have women with coronary artery disease. You know, they might have been more than 10 years since they went through menopause. At that stage, were denied HRT and now are listening to all these things on social media and going, hey, I want to actually get on board with this.
Yeah.
I'll do, to give them an opportunity to make an evidence-based choice for themselves. We'll do all the tests around their coronary artery disease and we'll find out that there is some minor coronary artery disease there. And I say, look, there's studies suggest that this is going to accelerate it. What do you want to do? But now we do have this patient-centred approach, which is really new since 2024. That has come out from both the guidelines from the British Menopause Society and now, thank goodness, from the European Menopause Society. And I don't think it'll be too long before Australian, American and international jump on board with that too.
Amazing. But what about the women that take the choice not to go through HRT and would like some natural remedies? What do you suggest?
So the most important thing for me to say here is that this is your body and your choice, and whatever you want to do is right for you. So now I'm going to give you the information with which you can make your decision.
Right.
When it comes to complementary and alternative therapies, we don't have a lot of studies that have a high degree of statistical significance. In order to get this statistical significance and not know that just you took this particular medication and you randomly got this result, but maybe your ovaries had picked back up. Because very rarely do ovaries just slowly putter out in a single direction. I have patients who go 2-3 months without a period, then every 2 weeks, and then go back for a year to every 28 days. That can happen. It's not a one-way street. And maybe that was happening. Or maybe there's a placebo effect, because we know in most of the complementary and alternative medicine trials, most of which have been done for hot flushes. It's a very Eurocentric kind of research world, unfortunately. The placebo rate is between 50 and 75%. So we don't have really good evidence that any complementary therapy works better than a placebo for any of the symptoms of menopause. None. And that includes the insomnia. Having said all of which, if you are using one and there is no damage to your liver, because we are just seeing at the moment in Australia ridiculous numbers of women ending up, some of them have died, some of them have needed a liver transplant. It's actually been horrific from herbal treatments. So they're not entirely, just being a herbal treatment does not mean that it has no side effects. They do. But as long as you know the benefits and the risks, Google it. It's fine to Google it. Then whatever you find brings you relief, I am very keen for you to have that. And I wouldn't say no to any of it.
Right.
All I want you to know is that we don't have any evidence for a benefit beyond a placebo. Now, what I do find with the placebo effect, this is just my experience as a clinician, is that a placebo effect will last for somewhere between 6 and 12 months. So my surgery is full of women for whom various subscription, very expensive complementary and alternative therapies were working and then stopped working. At some point, you are going to run into the placebo not working anymore. And then at some point, we risk that the timing hypothesis, remember that, if you've been without estrogen for a long period of time and then we try to reintroduce it, it accelerates your cardiovascular disease risk, that you are now up against that. So if you have placebo after placebo after placebo after placebo, and now it's been 10 years since you've been on menopause, you need to really think about whether you're going to go for hormone therapy. And what complementary and alternative therapies cannot do is reduce your risk of bowel cancer, reduce your risk of osteoporosis fracture, reduce your risk of heart disease, reduce your risk of dementia. Those are things that hormone therapy can do, but not the placebos.
Well, mainly they're buying time, if we can say. Yeah.
Yeah, I mean, the buying time can have its downsides too, right? Because if
Well, of
you
course.
buy time and shove yourself into the 10 years post-menopause, and I went to the International Menopause Society meeting in Melbourne last year, and there's increasing data that the timing hypothesis might kick in earlier than that 10-year mark. It looks like it might even definitely be happening at the 6-year mark. So now these days, even if it's been 6 years since you've had a period, then I would probably recommend that we do a coronary artery CT scan and a CT angiogram, just to make sure that you know what is the burden of coronary artery plaque in your arteries.
Wow, it's such a big world. And menopause, Dr. Ginni, if you agree with me, doesn't just affect women, it also impacts the families. So, in your opinion, how can partners and loved ones support someone going through menopause?
So I'm going to talk in very big relationship terms, because this is no different to you having a partner who's going through depression or going through severe back pain that you don't understand. And when you see someone you love going through something, your temptation is to say, oh, it's not that bad, or you'll get better, or you'll be fine, because you can't deal with their pain. So I'm going to say it's not about you right now, it's about the other person. And so I would approach this with humility, compassion, and curiosity. Tell me what's happening for you. Let me in. Let me understand what's happening for you. Right, I've never experienced that. Tell me what it's like to have hot flushes. So that compassion and curiosity and humility, you do not know it all. Just because you experienced something with a knee pain 20 years ago and X worked for you does not mean it's going to work for your partner right now. So if you can remove yourself from being the center of this entire drama and make it around her, and approach this with compassion, humility, and curiosity, that you want to know what is happening for her, then everything will flow on from that, and you will be the amazing support person that she needs. And how can I help is another great way. If you would love her to go to the doctor, and she's the sort of person who is in the Arab community in spades, who puts herself last. Women culturally in the Arab community are there for everyone else. They are amazing daughters. They are incredible sisters. They are unbelievable mothers and friends. And they're terrible at doing anything for themselves. So for any partners who are listening to us, why don't you say, you know what? We're both in midlife. Let's make an appointment and go to the doctor, and let's see how we can have our health sorted out. That's not a you. I'm not accusing you of anything. I'm not telling you why you're acting like a psycho. You never want to have sex with me. What's wrong with you? Take the you out of it. Let's go to the doctor. I think it's about time we got our blood pressure checked. Let's get some blood tests. Let's do that together. And then you're doing it as a team. But that does take humility, compassion, and curiosity. And I just bring that to every conversation.
Amazing. I am sure that most of the people hearing us today are going to just jump in and take another way to a rejuvenation, hopefully. I don't want to take much of your time, but I'm very curious as well to know about your skincare line. So you've created your own, as we may all already know. Can you tell us a little bit more about that?
Yeah, so I'm so humbled by it. I think it all started with me just needing to have the products as they were in the studies.
Right.
And also they needed to be appropriate for sensitive skin, because when you've got rosacea, everything burns and stings. The sunscreen you've used for years now you can't use anymore. Your skin is drier, so the moisturizers don't work anymore. So it started about me. I don't know if anybody listening to us has ever tried to start a small business, but you need a reasonable amount of capital. At that stage, I didn't have any capital at all. So my husband and I went, you know what, we've got a lot of friends in plastic surgery and dermatology, and we've been speaking to them over the years. Why don't you make your own skincare? And they're like, because I can earn $1,000 an hour seeing patients. I'm not going to take off time and spend a year developing a product. And we were like, but if we did it for you and did it just only according to the evidence, and we put your name on it, would you be happy with that? So our first business was called Aurora Care, and we now have 75 brands that we run for plastic surgeons and dermatologists with their names on it.
Lovely.
And then in 2018, when that was kind of a nice little instantly profitable business that made us feel really good, and I could hold my head up high and believe that I was helping people by them not buying rubbish and actually
Here and beyond. Let me say, it's lovely. We love it. Yeah.
amazing. So yeah, and then we launched our own brand, and I don't know when this is going live, but we have some huge things happening in the company, a big focus in the United States this year. We've had the last couple of years have been a big focus in the UK, but now we'll be focusing a lot in the United States through various channels that we've just signed quite a few big contracts. So it's been amazing. I'm so proud of it. I can hold my head up high and talk about skin and women's right to feel good in their skin. And for me, my skin now at 56, I'm going to be 57 soon, I don't do all the needling and I don't do any of that stuff. I just do skincare. But it's much better now, and it feels better now than it ever has. And it's just skincare. And if I can help other women like that, oh my goodness, I'll be so, so happy.
Amazing. Tell us the name of your favorite baby business.
Yeah, it's ESK, so Evidence Skin. That's and it's eskcare.com. And you can check it all out there.
That is lovely. I'll ask one last question about this. What makes it so different or unique than any other product out in the market?
So we don't cut corners. We just stick to what has been proven in independent trials. So if ESK sponsored a skincare trial, it would find that ESK is the best skincare in the world, because that's what sponsored trials do. You can't have the Pond's Institute telling you that Pond's is the best. It just doesn't work like that for scientists. So for me, we use independent trials that have been replicated a number of times, but there are different ingredients that are known to cause irritation and sensitivity. Those we will never, ever use. So now there's nobody whose skin is so robust that it will never respond to anything. But we do offer a 100% money back guarantee, no questions asked. And that's because we want people to feel that they can try our skincare and have the highest efficacy and yet the gentlest ingredients, because that's really important to me. Those ingredients are more expensive. So there are cheap things that you can buy by the kilo, and you could actually mix them in your garage tomorrow. Retinol, if you wanted to make a retinol product, you can go buy retinol off eBay and mix it in your garage, no problem. And there are a lot of preservatives and things that are cheap as chips. You could probably make a tub of it for like $15 and sell that. We don't cut corners. We don't cut corners. For us, what's really important is that we use the gentlest, the mildest, with no known excipients that have any irritation. We don't use scents. We don't use preservatives that are really tough on the skin. We don't use phthalates, parabens, anything like that. We just stick to the highest quality ingredients in the formulations that are done in the proper trials.
Awesome. I guarantee whatever you're saying, and please go buy some because they're amazing. As someone, Dr. Ginni, who works in media and medicine, you've probably come across a lot of health myths. What's one that you'd like to debunk today?
Collagen supplements, collagen powders and collagen supplements. So most of the positive trials have been sponsored. So they are going to be positive. There's no doubt about it. But the way your guts work, and I don't want to re-traumatize anybody by taking them back to high school science, but the purpose of your guts is you eat stuff. It goes into the acid bath to kill all the bugs. So the acid bath in your stomach, and then it gets let through into the small intestine. And the small intestine will bathe all of your food in enzymes that will break every single piece of food down into its individual components. And in the second half of your small intestine, that's where the small individual components of single sugars, single amino acids, single fatty acids are absorbed into the bloodstream. They float around for general purpose use by your cells to make everything from muscle cells to the lining of your arteries to your uterus to your eyes, and you need reasonable amounts of amino acids. And in the same way that you can't eat a steak and grow a steak on your face, you also can't eat a bovine collagen, a collagen out of a cow, and spot turn it into collagen in your face. Your genes have a recipe for your own individual collagen, and it needs a range of amino acids that a healthy diet can provide to you. Is there anything in a collagen powder that you can't get in your diet if you have It's a bit tougher if you're a vegan, but if you have a really good Mediterranean diet, which so many people from Arab lands actually have, your eggplants, your tabbouleh, your salads, your tomatoes, they are good foods that will actually beautifully enhance your gut microbiome and allow you to make collagen in your face as long as you have enough protein. So my one little caveat for collagen powder is that when I take a diet history, a lot of women are not having sufficient protein in their diets.
Right.
And you can't back end your protein and say, I'm going to have a piece of toast for breakfast, a sandwich for lunch, and then have a steak for dinner. Your body can only absorb a certain amount of protein at a time, and you need to have some protein at every meal. And you do need at least a gram per kilogram body weight per day just to maintain your skin, hair, muscles, bones. So just have a think about just a tip. An egg is 6 grams. A glass of milk, or milk in if you have a big milky coffee, is 6 grams of protein. So it's hard to get that protein, and it's possible that people are turning to collagen powder and seeing results because they're finally getting enough protein. But to me, a collagen powder is a processed food. It's no different to anything that's processed that we're telling you not to have. It's made in a factory by using lots of chemicals that are pumped through plastic tubing. I would much rather you had your beautiful traditional Arabic diet that is, to me, the best diet in the whole world, not only from a health perspective, but from a taste perspective.
Amazing.
I love it. And if you can go back to what your mother cooked, what your aunties cooked, that is the best diet for you ever, and it will keep your skin perfect.
Let's stick to some Lebanese barbecue then to keep our proteins high. People will love that, so let's go from there. Well, Dr. Ginni, thank you so much. It was such a pleasure to have you today on the show. Where can our listeners find more about you, your advice, your books, your social media, your website? Tell us.
So I'm absolutely shocking at social media, as you know. I am at Dr. Ginni, DoctorGinni on Instagram, where I occasionally remember to post because I'm hopeless. My books are all available on the ESK website.
Just to tell you, I've got them.
Yeah. Oh, you got all of them.
Awesome.
So they're all available on the ESK website, which is eskcare.com.
That is great. Thank you so much again for joining us and shedding light on such an important and often misunderstood topic. Informed conversations is exactly what we need more in our communities. In the end, to our listeners, your health is your power. Whether you're approaching midlife or supporting a loved one or simply wanting to understand your body better, remember, you're not alone and you don't have to suffer in silence. There's always help, knowledge, and support. Until next time, this is Christine from Scientifically Speaking on Oz Arab Media.